Don't stop. Don't stop. Don't stop. Don't stop. Don't.
The back of the thigh. Introduction. The posterior compartment of the thigh is also called the flexor compartment. It is incompletely separated from the medial compartment by the poorly defined posterio. Is a component of both these compartments are intermuscular septum. The adductor magnus. Dissection. Give a vertical incision on the back of intact skin left after the dissections OL gluteal region and the popliteal fossa. 8. See Fig 5.2. Reflect the skin and fasciae on either side. Clean the hamstring muscles and study their features from the tables 7.1 and 7.2. Sciatic nerve was seen in the gluteal region. Identify its branches in back of thigh to each of the hamstring muscles, including occasionally for the short head of biceps femoris muscle. Trace the two terminal divisions of this nerve. Separate the hamstring muscles to expose the ischial part of the composite or hybrid adductor magnus muscle. Look for insertion of adductor longus into the linea aspera of femur. Trace the profunda femoris vessels behind adductor longus, including its perforating branches. Cutaneous innervation. The skin over the back of the thigh is supplied by branches from the posterior cutaneous nerve of the thigh. Muscles of the back of thigh. The muscles of the back of the thigh are called hamstring muscles. They are the semitendinosus, the semimembranosus, the long head of the biceps femoris, and the ischial head of the adductor magnus. The hamstrings muscle has THR following characters: origin from the ischial tuberosity. B. Insertion into one of the bones of the leg. The adductor magnus reaches only up to the adductor tubercle of the femur, but is included amongst the hamstrings because the tibia. Collateral ligament of the knee joint is, morphologically, the degenerated tendon of this muscle. The ligament is attached to medial epicondyle, 2 mm from the adductor tubercle. C. Nerve supply form the tibial part of the sciatic nerve. D. The muscles act as flexors of the knee and extensors of the hip. The attachments hamstrings are given in tables 7.1 and 7.2. Clinica ANA 0. Hamstring muscles lying at the back of the knee can be accidentally or deliberately slashed or cut. If cut, the person cannot run, as these muscles are required for extension of the hip and flexion of the knee, movements essential in walking/running. Hamstrings have variable length. Some persons cannot touch their toes with fingers while standing straight, as their hamstring muscles are rather short. The inflammation of semimembranous bursa is called semimembranous bursitis. The bursa becomes more prominent during extension of knee, and disappears during flexion of knee. Sciatic nerve. The sciatic nerve is the thickest nerve in the body. In its upper part, it forms a band about 2 cm wide. It begins in the pelvis and terminates at the superior angle of the popliteal fossa by dividing into the tibial and common peroneal nerves. Origin and root value. This is the largest branch of the sacral plexus. Its root value is L4, L5, S1, S2, S3. It is made up of 2 parts, the tibial part and the common peroneal part. The tibial part is formed by the ventral divisions of the anterior primary rami of L4, L5, S1, S2, S3. The common peroneal part is formed by the dorsal divisions of the anterior primary rami of L4, L5, S1, S2. Course and relations. 1. In the pelvis, the nerve lies in front of the piriformis, under cover of its fascia. In the gluteal region, the sciatic nerve enters the gluteal region through the greater sciatic foramen. Below the piriformis. It runs downwards with a slight lateral convexity, passing between the ischial tuberosity and the greater trochanter. It has the following relations in the gluteal region. 2. Superficial or posterior, gluteus maximus, see Fig 5.14. Deep or anterior, a body of the ischium. B. Tendon of the obturator internus with the gemelli. C. Costratus femoris obturator externus. D. The capsule of the hip joint. E. The upper, transverse fibers of the adductor magnus. F. Medial inferior gluteal nerve and vessels 3 course in the thigh. The sciatic nerve enters the back of the thigh at the lower border of the gluteus maximus. It runs vertically downwards up to the superior angle of the popliteal fossa, at the junction of the upper 2/3 and lower 1/3 of the thigh, where it terminates by dividing into the tibial and the common peroneal nerves. It has the following relations in the thigh. Posterior, the sciatic nerve is crossed by the long head of the biceps femoris. Deep or anterior, the nerve lies on the adductor magnus. Medially, the semimembranosus, and the semitendinosus. Lateral, biceps femoris. The sciatic nerve is accompanied by a small companion artery which is a branch of the inferior gluteal artery. The artery runs along the sciatic nerve for some distance before sinking into its substance. Branches, 1 articular branches to the hip joint arise in the gluteal region. 2 muscular branches, the tibial part of the sciatic nerve supplies the semitendinosus, the semimembranosus, the long head of the biceps femoris, and the ischial head of the adductor magnus from its medial side. The common peroneal part supplies only the short head of the biceps femoris. Testing the hamstring muscles. Hamstring muscles can be tested by requesting the patient to flex the knee against resistance in prone position. Sciatic nerve lies on quadratus femoris and adductor magnus. Between the thin borders of these 2 muscles the nerve lies for a short distance on the femur. When a person sits on the edge of a hard table/chair, the nerve gets compressed between the edge of table and femur. It results in numbness of lower limb. But the sensations come back when foot is hit on the ground a few times and is called sleeping foot. Shooting pain along the cutaneous distribution of the sciatic nerve and its terminal branches, chiefly the common peroneal, is known as sciatica. Pain usually begins in the gluteal region, and radiates along the back of the thigh, and the lateral side of the leg, to the dorsum of the foot. This is usually due to compression of 1 or more nerve roots forming the sciatic nerve. The cause may be disc prolapse, neuritis, etc. The semimembranosus bursa may get inflamed. The condition is called semimembranosus bursitis. The sciatic nerve may be injured by penetrating wounds, dislocation of the hip. This results in loss of all movements below the knee with foot drop, sensory loss on the back of the thigh, the whole of the leg, and the foot except the area innervated by the saphenous nerve. Motor loss includes loss of hamstring muscles 1 oss of dorsiflexors, plantar flexors, everters and muscles of sole. Arteries of the back of thigh. The arteries on the back of the thigh are terminal parts of the branches of the profunda femoris. The lateral circumflex femoral branch of the profunda femoris divides into ascending, transverse and descending branches. The medial circumflex femoral artery gives acetabular branch and then divides into ascending and transverse branches. The main supply to the back of the thigh is through the perforating branches of the profunda femoris. These are described below. Perforating branches of the profunda femoris artery. The profunda femoris artery gives off 4 perforating arteries. They arise on the front of the thigh. They then pass through the adductor magnus and wind round the back of the femur, piercing the aponeurotic origins of other muscles attached to the linea aspera. They ultimately end in the vastus lateralis. The first perforating artery arises just above, or on the upper border of the adductor brevis, the second in front of the adductor brevis, the third immediately below the adductor brevis, and the fourth is the termination of the profunda femoris artery. The perforating arteries give off muscular branches. They also give off cutaneous and anastomotic branches. The second perforating artery gives off the nutrient artery to the femur. Anastomoses on the back of thigh. At least 2 distinct chains of anastomoses can be made out in the back of the thigh. One lies partly on the surface of the adductor magnus and partly in its substance. The other lies close to the linea aspera of femur. These longitudinal anastomotic chains are formed by the branches of internal iliac, the femoral and popliteal arteries. Thus from above downwards, 1 the gluteal arteries anastomose with each other and with the circumflex femoral arteries. The circumflex femorals anastomose with the first perforating artery, cruciate anastomoses. The perforating arteries anastomose with one another. The fourth perforating artery anastomosis with the upper muscular branches of popliteal artery. Another anastomosis is found on the sciatic nerve. This is formed by the companion artery of the sciatic nerve and the perforating arteries. These longitudinal anastomoses provide an alternative route of blood supply to the lower limb, bypassing the external iliac and femoral arteries. Sciatic nerve is the thickest nerve of the body. Sleeping foot is temporary condition. Hamstrings are flexor knee and weak extensors of hip. Adductor magnus is a hybrid muscles. Thin artery accompanying sciatic nerve is part of the axial artery of lower limb.